So I was trying to look for a normal tongue, but all the tongue that I have are patients. So they are all working in progress. So there's not an exact perfect tongue that I can find. And then as a matter of fact, in traditional Chinese medicine doctors' eyes, nobody is normal. Everybody has something, right? And we all know that we all have something going on here and there. So relatively, a normal tongue is depicted like what we say here. But whenever we take a picture of a patient's tongue, we always trying to compare apple to apple, which means we have to make sure that you compare this person within themselves instead of compare this person with other person, because every one of us have a different constitution, different age, okay, different stage of their life, and different lifestyle. For example, a person who can be very young and then they unfortunately they just have a baby and then they need to take care of the baby, so they work hard. So you cannot say, but they're trying their best to live their life. So you cannot say that, oh, your tongue is not good. But this is the best tongue they can have at this moment. So we shouldn't discourage our patient. So we only can compare the tongue afterwards with the previous tongue, and to show them, hey, before it's like this, now this is like that. So you are improving. So as a matter of fact, I'm also improving. My tongue is not perfect either, but then at least my tongue is better than the day before or the 1 month before, or trying to maintain the tongue like the one I have when I was 20 years younger. Then we're doing a great job. So there's no perfect tongue, but relatively perfect. So like this patient, there's a couple things that the shape is not enlarged is okay, but you can see that this side of the tongue is relatively smaller than this area. That means that this person actually is big on the upper parts of the body and then smaller legs. Why the leg is smaller? Because the kidney is deficient, right? There's 2 things here. The kidney is deficient. That's why the lower parts of the body is relatively cold. When there is relatively cold, then there's a relatively too little bit more water retention in the lower abdomen. This micro level of water retention only causes bloating. It won't show in the top in the coding. It will only show in the bulging. So that's why this area is slightly bulging out, means that there is a lower abdomen bloating in the lower abdomen. And there is a relatively little dims, which means that there's containing of water. The water retentions in the body is relatively more than what is supposed to be. That's why there's a dim on both sides and more stronger on the left side, which means his left limbs is weaker than the right limbs. And on top of that, there's a little bit redness on the surface, and especially on this side, which means that there is a heat built up in the shoulder area, which means a little bit tension and tightness on the right shoulder than the left shoulder. But the left shoulder, this one can tell because of this is the shade on this side. So maybe there's also a little bit, but there is a little bit dims into it. Somehow the sleep is a little bit affected and the vision is a little bit blurry because there's not enough blood flows into the brain. So, and there's a slight cracks in the middle, which means they used to have some digestion issue, but it's healing pretty well. Mainly the problem is in the small intestine. I believe this person is an IBS, recovered. So that's why. So when you take a look at the tongue, when you enlarge, trying to use your skin to look at it, there's so many things you can tell. And